Let's talk about the do's and the don'ts of using bands to help your hip impingement. Because there's a couple things that can help and there's a couple things that can harm. So one of the first things to do is to know that when the band is distracting your hip backwards into the back of the socket, so it's deeper in the socket, that's generally a good thing to do. When you switch around and the band is pulling your hip forward into the socket, that's a little hit or miss. It can be good or bad depending on the individual. Some people who are dealing with FAI or hip impingement, this won't feel good on their hips. Just your basic hip flexor stretches can sometimes feel for these people that they're getting kind of like a sharp, not good stretch feeling in the front of the hip, and it can be doing damage. So be careful with distracting your hip forward in the socket, but in general, distracting it back into the socket can work well. So let's go over a couple exercises. One is the band distracted hip capsule mobilization. So get the band, maybe a foot up on the pole, put a pad underneath your knee, come forward, get some distraction. The bigger and stronger you are, or the thicker and tighter you are, the more distraction you'll want. So get enough where it feels like you get less impingement when you go into this. And bring your leg across into external rotation and block it with your own knee. Move your torso way, way forward so you're not in a lot of hip flexion. If my torso is back, I'm in a lot of hip flexion and I'm going to get closer to risking that impingement. Know that you don't want any bad feelings here, no pain, tightness, pinching. And then what you want to do is get a lot of pressure down through your knee, like your whole body weight is balanced on top of that knee. Get all that pressure there, stick your butt out and slightly lean forward. If you're feeling any kind of slight impingement in the front of the hip, what I like to do is drop down to my elbow and twist and push this backwards. So I'm just doing more of what the band is already doing. So I'm here, I'm hunting around, leaning to the side, leaning to the other side, getting in all kinds of crazy positions, and what I'm looking for is a sensation of deep pressure in the back of the hip. Sometimes this takes contorting yourself into crazy positions to get the stretch in the back of the hip. Some people complain that even the distraction of the band doesn't take away their hip impingement feeling, and it really takes some experimentation and using your hands and leaning in different directions until you get it just right. It's always a little harder for me on the side that I've got my cam impingement on, but with practice you can get it where, that just doesn't feel like an impingement, just feels like a deep kind of back of the socket glute stretch. And you breathe and you wiggle around and let it kind of sink in. So explore with that. The next thing that is a do of band distraction is to go into internal rotation. And again, lean way forward so you're not in too much hip flexion. What feels good for my body is to take this hip and drive it out to the side and then come into hip flexion. So I'm forward, to the side, then dropping into hip flexion. So again, wiggle, experiment, use your hand to give yourself a little extra push. When you find a good spot, breathe and sink. If you can make this feel comfortable, and maybe you have to do a bunch of tissue work and stretching before you even do this. That's kind of where I was 4 years ago. I had to do a bunch of stuff just to be able to get into this position. But once you do it, it can really help giving your hip a lot more range of motion. So that's a do. Another do is to use the band for hip distraction when you're doing hamstring stretches. And you could hook something around your foot or just grab your ankle, breathe and relax, get a stretch or even get an adductor stretch out to the side like this. Basically what the band should help you with is gliding the femur in a better position in the socket and giving you less impingement feeling. So stretch your muscles using the band here. That's a do. That's good. Or you can flip it around, put your leg out to the side like this, and then let the band pull you back and get a stretch in that way. This is usually a stretch called the goalie stretch that people complain they feel something in their lateral hip that feels like an impingement feeling, and this band can help take that away. So if you get enough band tension, stick your butt out, maybe you lean your torso away from it. Different things can help. You can push with this hand, you can rotate, wiggle, grab your foot. The key is in the experimentation. I'm never just holding one static linear position when I'm stretching. I'm always refining it. Another do for band distraction is to use it in glute stretches. Either a glute stretch laying on your back can possibly feel good. Punt around, again, explore just different positions and angles, or possibly try it in your pigeon pose type stretches and see what that does. Use your hand. I always like to use my hand to kind of position my hip in a better place. So that's a good thing to use the band for. The main thing that is a don't about using the band, don't think that the band is going to fix all of your problems with your hip impingement. There's a lot of videos on YouTube that say that the band is how you fix it. It's a little more complex than that. It requires several things, and I have another video about that. So don't think that the band will fix all your problems. And be careful when you're doing the one where the band is pulling your hip in a forward manner. Those are the two big don'ts. Of course, always experiment for yourself. For some people, this stretch really works, but for others, it can really do harm. So you got to find what's a do and what's a don't for you, but I wanted to give you those basic guidelines about band distraction for hip impingement. So give them all a shot.
Yeah, be cool,